Okay, here we are in the last chapter, chapter 7. We're going to look at therapies as it relates to psychological disorders. Now, therapy is any type of treatment for emotional or behavioral disorders that use psychological rather than biological means. Now, we will review a couple of the sort of biologically based therapies, which will include medications. In this particular part 1, we're going to look at insight therapies, and I'll sort of walk you through briefly psychodynamic, humanistic, and Gestalt. And then we're going to go through another category of therapies known as relationship therapies. This is where we go through either coupled therapies, family, or group therapies. And then lastly, we'll look at some behavioral therapies. And what we'll look at in particular will be behavior modification using operant conditioning, therapies based on classical conditioning, and therapies based on observational learning. And so the first one we're going to look at is looking at psychotherapy, and most notably looking at the insight therapies as it relates to psychodynamic therapy. Now, the approach to psychotherapy is based on the notion that psychological well-being depends on self-understanding. Understanding one's own thoughts, emotions, motivations, behaviors, and coping mechanisms. Now, psychodynamic therapies in particular focus on an attempt to uncover childhood experiences that are thought to explain the patient's current difficulties. So our past implicates our future in terms of the challenges that we have. Now, psychoanalysis, which is Freud's first psychodynamic therapy, uses a few methods. One is called free association, and I'll review that just briefly, dream analysis, and transference. Now, free association is a technique used to explore the unconscious by having the patient reveal whatever thoughts, feelings, or images that come to mind. So you would be asked just to free think. Whatever's on your mind, you talk out loud about. The analysis pieces together the free-flowing association, so looking for patterns, and explains their meanings. It makes it a fairly much, pretty much a directive therapy. The therapist plays a role in the interpretation and the connecting of these themes through free association. Helps the patient gain insight into troubling thoughts and behaviors. Now, one of the advantages to doing this is it takes your conscious mind out of the experience. Free association is just to say what comes to mind without thinking. So you're trying to take it out of your conscious mind. Now, there is an element that he incorporates, or a thought that he incorporates, called resistance. And this is when the patient avoids revealing certain painful or embarrassing thoughts. They'll either forget appointments, they'll arrive late, they will create what he would call resistance to the process. Now, he also incorporated, as I mentioned, dream analysis, and this is an area of repressed emotional concerns that would be expressed symbolically in dreams. And again, this was highly interpretive. It wasn't very scientifically based. As you can imagine, dreams could have many different meanings, and it really depends upon, as we've learned in more current psychology, that dreams aren't necessarily based on the single explanation theory. Some are random based, that your dreams are just random firings that the brain is making sense of. Some is based on the notion the brain is restorative through dreams, and some is that dreams are some ways of working out past experiences or planning for future events. It's not clear, so his dream analysis as an interpretive expression was somewhat questionable. Now, the third element that I introduced in the beginning was to talk about transference. This is the emotional reaction that occurs during psychoanalysis. The patient displays feelings and attitudes towards the therapist, if you will, that were present in another significant relationship. Freud believed that it was an essential part of therapy. Patients can relive troubling experiences from their past with the therapist as the substitute for that person. And we'll see this reemerge in another therapy called Gestalt Therapy. This aids in the resolving of hidden conflicts. It allows the person to express things to this person through using the therapist in its place. Now, the psychodynamic therapy is relatively brief. The patient and the therapist agree beforehand about what issues to work on rather than waiting for them to emerge. The therapist assumes an active role Not all therapists that we'll see will be actively involved in the health of the patient. Some will be more non-direct. Now we're going to look just briefly at another form, and this is Humanistic Therapy. And Carl Rogers was very instrumental in this area. This theory, or this sort of therapy, assumes people have the ability and the freedom to lead rational lives and make rational choices. And what Carl Rogers was responsible for was person-centered therapy. And this was a very non-directive. The therapist didn't take an active role in what the patient did. It's based on humanistic therapy developed by Carl Rogers. The therapist creates an accepting climate and shows empathy. One of the key pieces of what Rogers introduced was what was called unconditional positive regard. And so this frees the client to be themselves, releasing their natural tendency towards self-actualization. Psychological disorders result from when a person's natural tendency towards self-actualization, that term comes from Maslow's hierarchy of needs, which also falls within the humanistic approach to psychology. So when these natural tendencies towards self-actualization are blocked by other people or by ourselves, the therapist will emphasize the client's concerns and emotions. So would say, what I hear you saying is a common phrase that that Carl Rogers would say. He's not interpreting what you say, he's trying to repeat back to you what you've said to him. Reflective listening used in responses allows the client to control the direction of sessions rather than the therapist. Rogers rejected all forms of therapy that cast the therapist as an expert who prescribes something to cure the problem. Now, along the same sort of lines of insight therapy is Gestalt Therapy. Now, this takes more of a direction of Freud's psychoanalysis in that there is a directiveness that the therapist takes. This was originated by Fritz Perls and emphasized the importance of clients fully experiencing in the present moment their feelings, their thoughts, and their actions. And from his perspective in Gestalt Therapy, clients must then take responsibility for those feelings, thoughts, and actions. The goal of Gestalt Therapy is to help the client achieve a more integrated sense of self and become more authentic and self-accepting. Learning to assume personal responsibility for their behavior rather than blaming society, blaming past experiences, blaming parents, blaming others. The directive part of the therapy was any type of the therapy in which the therapist takes an active role in determining the course of therapy, provides answers or even suggestions to the patient. One of the major objectives was to get in touch with your feelings, and those in need of therapy carry around unfinished business. And one of the strategies they used a lot is what was called the empty chair technique. And essentially what they would do is, with the patient sitting in one chair, they would provide an empty chair, and the patient would talk to that person or that circumstance that was interfering with them able to gain control and resolve those issues with the empty chair. And so it was a technique used for Gestalt to help them take responsibility for the parts of the dynamic that was theirs to take responsibility for. Now, in another direction, therapies, if not done on an individual basis, can be done in group or in relationship therapy. And there's two forms that we'll start with. One will be the traditional behavioral couple therapy. When we look at relationship therapy, it's an attempt to improve patients' interpersonal relationships or create new relationships to support patients' efforts to address psychological problems. So the traditional behavioral couple therapy focuses on behavior change. Observe actions. The therapist would observe interactions and assess accuracy of complaints and to identify each spouse's strengths. It's an attempt to modify problem behavior and enhance items helpful to communication process. Now, alternatively, the integrated behavioral couple therapy, this emphasizes both behavior change and mutual acceptance. Problems arise from changeable behaviors, the individual and the personality traits of both partners. He helps couples learn to accept and adjust to each other's personality rather than trying to change them. Now, Along with relationship therapy, as much as it could be between two people in the couple relationship, they also introduced with this family therapy, and this involves the entire the entire family. The goal is to help family members reach agreement on changes that will help heal the family unit, improve communication, create understanding, enhance harmony within the group. Dynamics of the family unit, how family members communicate, how they act towards each other, how they view each other, are important to this process. Positive effect on treating disorders and clinical problems, for example, sexual dysfunction, schizophrenia. When the therapy is accompanied by medication, it can be very useful. Reduces relapse by reducing criticism and hostility over emotional involvement. It's also very helpful in adolescent drug and alcohol abuse. Now, along the same line, working in groups, but not necessarily family, is looking at group therapy. Several clients would be involved in this. 7 to 10 is considered a fairly usual number. They meet regularly with one or more therapists to resolve personal problems. It's less expensive than regular therapy. It provides individuals with a sense of belonging, an opportunity to express feelings, an opportunity to get feedback from other members, and chance to give and receive help for emotional support. Now, along this line, you would see examples of self-help groups. Usually these are not led by professional therapists. They provide people who share a common problem a chance to meet and get support. Most focus on a single problem, drug abuse, depression. You'd have groups, self-help groups like Alcoholics Anonymous. It's the oldest and best known and has about 1.5 million members worldwide. The derivatives of Alcoholics Anonymous is Gamblers Anonymous, Overeaters Anonymous, Narcotics Anonymous, Sex Addicts Anonymous. These are all self-help group therapies, which many of the people who participate in find them particularly helpful. And then the last group that we'll go through in part 1 will be looking at behavior therapy. Based on the idea that abnormal behavior, or abnormal, is an idea that's learned. It's not a sign of an underlying disorder. If I'm afraid to fly, then the fear of flying is the problem. It applies the principle of operant and classical conditioning, or observational learning. It eliminates inappropriate or maladaptive behaviors and replaces them with more adaptive responses. It doesn't change the individual's personality structure or searches for the original problem. Unlike Freud's, where they will go back into your childhood to look for the source of this problem, behavior therapy doesn't consider that the past really impacts. It's the behavior that's occurring right now. Let's find an adaptive solution. So behavior modification is using the learning principles to eliminate inappropriate or maladaptive behaviors. And replace them with more adaptive ones. So seek to control the consequences of behavior. Extinction of undesirable behaviors accomplished by terminating or withdrawing the reinforcement, and seeks to reinforce desirable behavior to increase frequency. It's best done in hospitals, prisons, or school classrooms. Now, the indication I've shown you at the top of your screen, the ABC, is looking at antecedent, behavior, and consequences. And so what the behavior therapist is looking for are, what are the antecedents, this set of circumstances that set the stage for the behavior to occur. The B is the behavior. What is it descriptively? The see and hear of what the behavior is, not what one thinks about it. And the consequences, what is the result of that behavior? What are the reinforcements for the behavior that exists? It doesn't make a judgment about what is happening after. If the behavior is increasing, then it's being reinforced, whether it looks like it's being reinforced or not. Now, when we look at token economies as a form of behavior modification, these are based on rewards that are rewarding appropriate behavior with tokens. These things would be like poker chips, coupons, play money, stars, and stickers. You've probably seen them in schools. Tokens are later exchanged for desired goods and or privileges. Weekend passes, candy, gum, TV time, etc. Undesirable behaviors can be fined with a certain number of tokens. So It's an exchange system. It's not unlike your paycheck, really. For the kind of behaviors you exhibit at work, if you fulfill your expectations, you get a token pay slip, but then the money shows up in your account, and you can choose to spend that as you would like. That would be your gum, your candy, your weekend passes. Now, there is another element about behavior therapies, in particular working around children, but not exclusively. It's using the technique called timeout. Now, I'm only going to briefly touch on this because token economies and timeout, as much as they might be used frequently, the reason that they fail is that people are not using them correctly. And so I'd rather not just go into them briefly and expect that someone might try to use them without knowing exactly how to use them effectively. Timeout is used to eliminate undesirable behaviors by withdrawing all reinforcers for a period of time. And what's key here is you need to know what is reinforcing, and we're not always correct about what we think is reinforcing. If they do undesirable behaviors, they will be removed from the situation for a period of time, in a place where there's no reinforcers. And again, you need to know what is reinforcing. So no toys, friends, television, or books, or whatever. The undesirable behavior will stop if it is no longer reinforced. What's really, really critical, important is being consistent. And we as parents and providers of care sometimes aren't as consistent as we think we are. And therefore, some of these programs won't work as effectively as if we could be consistent. If we carry on with behavior therapies, we can look at some other variety of behavior therapies. Systematic desensitization. Now, what we're doing here with systematic desensitization, a lot of phobic responses are dealt with this. Here we're using to treat fear by training clients to deep muscle relaxation. Then they confront a hierarchy, and from very low stimulation of fear to much higher, and working their way up. That's what the hierarchy is, of anxiety-producing situations. Now, I used the example in the image there of a spider. So if they have a fear of spiders, they might start by looking at a picture of a spider and work their way up to be able to handle a spider. So the hierarchy of anxiety-producing situations, real or imagined, they repeat until they remain relaxed, even in the most feared situation. Highly successful treatment for eliminating fears and phobias in a short period of time. Now, the other alternative is what's called flooding. And this is where you used to treat phobias by exposing clients to feared objects or events for an extended period of time until the anxiety is decreased. The client with a fear of heights may stand on a roof or a high building until anxiety subsides. Sessions do not end until the patients are markedly less afraid. For flooding, it might work well. It would take up to 6 sessions in many cases for it to have a desirable impact. Now, in addition to behavior, other therapies is called exposure and response prevention. A behavior therapy that exposes clients with obsessive compulsive disorder to stimuli that triggers obsessions and compulsive rituals, while clients resist performing the compulsive rituals for progressively long periods of time. Exposes the patient with obsessive compulsive disorder to stimuli that triggers the obsession and the compulsive rituals, touching a doorknob, piece of unwanted fruit or a garbage bin. Patients resist performing the compulsive rituals for progressively longer periods of time, washing their hands or bathing. The therapist identifies triggered thoughts, objects, or situations. Typically takes about 10 treatment sessions over 3 to 7 weeks to bring about a 60 to 7% of the patients into a better position. Now, alternatively, and this is a route that some people take with things like smoking or alcohol use, is aversion therapy. This is where you use an aversive stimuli is paired with a harmful or socially undesirable behavior until the behavior becomes associated with pain or discomfort. Negative behavior is paired with a painful, sickening, otherwise adversive stimuli until the behavior becomes associated with that pain or discomfort. Electric shock or medics causes nausea or vomiting. Antabuse is a medication that reacts violently to alcohol, causing the person to vomit until the stomach is empty. Sometimes people will paint their fingernails with a bitter tasting coat to stop nail biting, and that would be an aversion therapy. Participant modeling is an appropriate response to a feared stimuli is modeled in graduated steps. So they would be asked to demonstrate this appropriate response to the feared stimuli, and they would do it a little bit at a time. In behavior therapy, that's called chaining. You would link behaviors a bit at a time to get to the fully acceptable behavior. So what I've done is just given you a quick overview. You find some of these a little bit more detailed in your textbook. That's part 1, and we'll move into part 2 next. Thank you very much.